Now we shift our focus to RAC audits, also commonly referred to as post-payment audits. We will explore the legislation and terminology in a moment. Many important healthcare reform goals. However, the one most often debated is the overall reduction in the cost of healthcare delivery. The federal government has a great deal riding on reducing healthcare costs, and you are at the center of their bullseye. Running a medical business has always been difficult, but is about to get much worse. Take a moment to familiarize yourself with the following terms. They will be used throughout this section of the presentation. The most important terms are OIG, or Office of Inspector General, and RAC, or Recovery Audit Contractor. On October 7, 2010, the OIG released its 2011 work plan. The initiatives include audits, investigations, and inspections. The OIG will focus its efforts on ensuring compliance with certain highly technical billing and reimbursement requirements. Current RAC-specific legislation provides for a reachback that allows auditors to go back to 2007 records. States were required to establish Medicare RAC programs by December 2010. These programs had to be implemented by April 2011. There are some staggering RAC statistics, and we are still in the very early phases of the program. During implementation, over $1.3 billion of improper medical payments were found in only 5 states. In the full phase implementation, the government expects to find over $900 billion of improper payments. The RAC program is the most aggressive measure taken to date by the federal government to prevent waste, find fraud, and abuse in medical billing, and recoup monies associated with abusive activities. Often compared to bounty hunters, RAC contractors retain 9 to 12% of payments recovered by the government. This pie chart represents the reasons for RAC overbilling determinations. Number 1, failure to meet Medicare medical necessity standards. Number 2, incorrect coding. Number 3, undetermined. And number 4, insufficient documentation. It is very important to understand how overutilization is detected. ZPICs focus on detecting, deterring, and preventing fraud and abuse. There are 3 practices that increase your likelihood of triggering a ZPIC audit. The first is high utilization of services. The second is the high cost of services. The third is submitting insufficient documentation. ZPIC's use of highly sophisticated computer modeling data to predict utilization patterns leads them to the most frequent offenders. It's not a matter of if your medical practice will get audited, it's a matter of when. The good news is you can take some proactive measures to design a compliance program to facilitate audit success. These steps follow a simple pattern: receive, track, trend, communicate, and improve. You should be paying special attention to highly productive physicians, especially in the following specialties: cardiology, neurosurgery, orthopedics, and pain medicine. You should be conducting self-audits that evaluate the medical appropriateness of services provided, as well as adherence to industry professional standards. There is a landmark case involving alleged overutilization happening right now in Maryland. Dr. Mark Madej is accused of inserting 585 patients with stents that may not have been medically necessary. This case has received worldwide attention and is at the cross-section of the federal government's aim to tackle fraud and abuse. The case is still unresolved. However, St. Joseph's Medical Center in Maryland, Dr. Madej's employer, has settled with various parties for $22 million. There are many similar cases to that of Dr. Mark Madej, but we don't have time in this presentation to cover them all. Other things that this presentation did not cover are the following areas: documentation improvement challenges and goals, RAC appeals process, peer review process, electronic submission of medical documentation, and vendor management. The quickest, most affordable, and safest way to protect your practice is to purchase RAC Audit insurance from Healthcare Synergies. MediSure is specifically tailored to healthcare professionals facing RAC audits and covers defense costs and civil fines and penalties for billing errors, HIPAA, EMTALA, and Stark proceedings. Coverage is provided for both governmental and commercial private payer audits and investigations. In closing, we would like to remind you again that all of the risks and exposures we discussed in this presentation are insurable through custom insurance products available only at HIPICS and HCS. For questions, please contact a HIPICS representative or visit our website to learn more. Additionally, you can find HIPICS on Facebook and LinkedIn, where we regularly publish articles on medical malpractice, patient health information breaches, RAC audits, and employment practices liability.